September is National Cholesterol Month, and millions of Americans are walking around with dangerously high cholesterol levels without even knowing it. It is called the silent killer, yet it is a major risk factor for heart disease and stroke. Leanne Bloden, a registered dietitian and clinical researcher with over 25 years of experience, joining us now with this topic. Leanne, thank you for being patient and joining us here on Live Impact News.
Yeah, thank you, Jane.
Leanne, let's talk. Let's go to basics first. You know, we've heard that cholesterol, there's good and bad. Distinguish what that means and what exactly is cholesterol.
So cholesterol is a type of lipid or fat, and we actually need it for a number of bodily functions. But when we have too high cholesterol, it really increases the risk of heart disease. Now, LDL cholesterol, or low density lipoprotein cholesterol, is the bad cholesterol. And what we mean by that is after the body takes what it needs from cholesterol in the blood, the remaining amount in the blood is LDL cholesterol, and it's circulating and can deposit in the walls of our arteries, and it can really limit the blood flow. This limitation of blood flow can really increase the risk of having a heart attack or stroke.
All right, so when you say it is the silent killer, how common is it for people then to have dangerously high cholesterol without knowing it?
So it is the silent killer, which means there are no symptoms when you have high LDL cholesterol, but you can have a simple blood test at your doctor's office, often called a lipid panel, that will give you your numbers. And it is common. About 100 million Americans have high LDL cholesterol and need to have treatment, because we know that lowering LDL cholesterol does lower risk of having a heart attack and stroke.
Are we talking about certain age groups? And 100 million people, that is, I didn't know it was that many.
Yeah, it is a lot. And actually, the recommendations are to start getting your cholesterol tested when you're a child, but you should definitely know your numbers. And there are some risk factors that may predispose people to having high LDL cholesterol. First of all, anyone can have high LDL cholesterol, but if you have a family history of high LDL cholesterol, or you've had a family member that may have had a heart attack or stroke at an early age, or you yourself have other risk factors such as high blood pressure, diabetes, these may all suggest you're at risk for heart disease, and you need to know your LDL cholesterol number.
All right, so when it comes to numbers, when you get those results back, what do they all mean?
Yeah, so really the numbers are dependent on your own situation. So you have to talk to your doctor, because the higher risk you have, meaning if you have heart disease, or if you have, depending on the number of and type of risk factors you have, you may have a lower LDL cholesterol target. So your doctor will go over that with you, and also what are the right treatment options for you.
All right. So in your 25 years of research, hopefully we've seen some progress in the way of modern medicine or the like, and what you can do to treat or reverse some of that high LDL. What are some of the trends you're seeing that we should be concerned about? What can we do about it?
Yeah, well, so first of all, you need to talk to your doctor to see what's right for you. But for people who need more than just diet, so they need drug or pharmacological therapy, there are options out there. So, statins are routinely recommended first for lowering cholesterol and reducing risk of heart disease, but not everybody can take a statin, or maybe they can't take it at a dose that their doctor has recommended. They need other alternatives. That's like people with statin problems, or who can't take it in the amount they need, have what's called statin intolerance. Some of the side effects are often muscle, so generalized muscle pain or weakness. Now, there are statin alternatives that lower cholesterol and reduce risk of having a heart attack, and also like those procedures we don't want to have, stents or bypass surgery. And we actually, Jane, have a educational campaign where we talk about these alternative statin intolerance, and actually have created these fun cartoon characters that really relate the dangers of high LDL cholesterol and heart disease.
Oh, look at those visuals. Yeah. So what do you wish that everyone American, everybody in the country should know about cholesterol and heart health?
Yeah, so the first thing is get it measured. If you don't know your LDL cholesterol, talk to your doctor. It's a simple blood test called a lipid panel where you can find out your numbers. And then there's a website, statinalternatives.info, which goes through wonderful information you can educate yourself about and talk with your physician that talks about the high LDL cholesterol, statin intolerance, what are the alternative medications, and how to reduce your risk of heart disease.
All right, Leanne Bloden, dietitian and researcher, thank you for all of the information and education on our heart health and cholesterol. Definitely keep that to mind.
Great.
Appreciate
Thank you, Jane.